name is Irene, along with Sasha and Aman. We argue that the best counseling approach to use with substance misuse patients is cognitive behavior therapy, CBT. Dr. Arnold Burke pioneered cognitive behavior therapy in the 1960s. According to Burke Institute of Cognitive Behavior Therapy, Dr. Burke was a psychiatrist, and he also studied and practiced psychoanalysis. He carried out a number of experiments to test psychoanalysis on individuals experiencing depression. Unfortunately, he was unable to validate the fundamental concepts of psychoanalysis. Therefore, Dr. Burke started to look for other ways to conceptualize depression. Dr. Burke observed that depressed individuals experience negative thoughts about themselves, the world, and or the future. And these thoughts appear to arise spontaneously. So he called these cognitions, quote unquote, automatic thoughts. Then Dr. Burke started to help these individuals to identify and evaluate these automatic thoughts. He found that by identifying and evaluating these thoughts, patients were able to think more accurately, feel better emotionally, as well as behave more functionally. Accordingly, Dr. Burke called these techniques cognitive therapy, and it's also known as CBT. CBT has been scientifically tested and found to be effective in treating a variety of disorders. Hundreds of clinical trials have demonstrated its effectiveness for psychological problems such as relationship difficulties and compulsive gambling. Psychiatric disorders including substance use, anxiety disorders, eating disorders, personality disorders, bipolar, and schizophrenia. And medical problems with the psychiatric component such as somatoform disorders, sleep disorders, and conditions involving chronic and acute pain. During my clinical, I observed a nurse use CBT approach with a client who was not motivated and had low mood. The client mainly stayed in the room, laid in bed for long periods of time, and did not participate in any activities. The nurse used a collaborative approach with the client to help identify social activities that the client feels meaningful. The plan was for the client to start with a simple daily routine. For example, a time was negotiated for the client to wake up daily, go for walks, participate in unit crafts and art activities. Later during the day, the nurse asked the client how he feels, what the client did to feel positive, and what other activities the client thinks will help him maintain a positive mood. The nurse also encouraged the client to add more challenging activities as tolerated to his daily schedule.
Hi, I'm Sasha. I'm arguing that CBT is best for the substance misuse client. And the relevance of CBT for an RPN is that you can work both in the community and in an acute setting. In my own personal clinical experience, I saw a girl that was committed in the psych ward against her will, and she was there for a period of time for depression. Also, she had substance misuse issues. She was working with a psychiatrist, and she would visit with a psychiatrist every week. And she would be given a one-page questionnaire to fill out. And this included discussing her thoughts and feelings, her personal experiences. And it gave the psychiatrist a way to see the world from her perception, but also a way for the girl to reread it with the psychiatrist and identify her thoughts and feelings and how they contributed to her behavior. And so CBT was built on the framework of the questionnaires. There were about 10 of them. So when she was released from the acute setting and she went into the community, she continued to work on an outpatient basis with the psychiatrist and continued to fill out those progressive questionnaires until she was able to identify why she behaved the way she did and why she used drugs the way she did. So that's the relevance as an RPN.
And in regards to relevance of CBT for psych nursing practice, we meet numerous substance use patients or clients who require treatment. It's important to quickly determine the root of the issue. Using CBT, we can quickly understand their thoughts and feelings and the reasoning behind their behavior. Using CBT, we can help patients strategize effective coping behaviors and skills.
CBT in the area of substance misuse relies on the notion that reinforcement and conditioning contribute to the development of addictive behaviors. Skills that can be used by registered psychiatric nurses include looking for positive and negative results of substance use, monitoring and teaching client to identify cravings, helping client become aware of high-risk situations, and importantly, collaborating with clients to come up with approaches for coping with and preventing high-risk situations and cravings.
Another best fit, so Irene had mentioned that in the history that depression is used with CBT, and there was a lot of experience with people with depression. So I argue that it's a best fit with a person with addictions because they often have coexisting problems such as depression, such as anxiety. And when somebody has stress and anxiety and it spirals and it gets so out of control, the way that they cope with it is they go and use a substance. So an actual CBT technique is the technique of deep breathing. A person who's experiencing stress and anxiety can learn deep breathing techniques. They learn to identify the feeling, to stop before they get into the contemplative stage of using. They do use the deep breathing, and it actually controls their impulse and their urges and their coping mechanisms. And so that's an actual behavioral technique to stop the substance misuse.
And I'm just going to continue on from Sasha. As psychiatric nurses, we can help clients with and educate them about the following cognitive behavioral strategies, like self-control strategies, which consist of goal setting, self-monitoring, and learning alternative coping skills. Social skills training, which pays attention to learning skills that form and maintain interpersonal relationships, assertiveness, and drug or alcohol refusal. Behavioral contracting, this is a written agreement that a nurse prepares with the patient, which identifies targeted patient behaviors and consequences. Contingency management. In this strategy, patients are offered incentives or rewards for adopted behavior or for meeting identified behavior goals, such as compliance with treatment, clean urine, or negative drug tests. This is based on principles of operant conditioning, which indicates that behavior that is followed by positive consequences is more likely to be repeated. Cognitive behavioral strategies have been proved to be effective during treatment for alcohol and other substance addictions. CBT is effective in psychiatric nursing practice because the psychiatric nurse and client develop a therapeutic relationship on the basis of genuineness, warmth, and empathy, which are fundamental of psychiatric nursing practice. So the nurse has the ability to initiate CBT effortlessly if the client is compliant with treatment. In cognitive behavioral interventions, it is important that the nurse has a comprehensive understanding of the problem. Therefore, the following questions may be addressed, like what is the problem, how did the problem occur, where did it occur, when did it occur, or what makes a problem occur, and what are the feared consequences related to the problem. And the nurse has scales to be able to assess the frequency, intensity, and duration of the problem. Next, the nurse determines the patient's experience with his or her problem by utilizing a behavior analysis. And the analysis includes an antecedent, behavior, and a consequence. And the antecedent can be a craving for the drug. The behavior can result as in like using the drug, and then the consequence is like a negative effect. And cognitive behavioral implementation is aimed at the following goals for substance use patients, which includes increased activity, reducing unwanted behavior, increasing desired behavior, increasing pleasure, and enhancing social skills.
Our clarifying questions are, the first one is, how does CBT create feelings of self-worth and confidence in the substance misuse patient?
Second question is, how can CBT help the substance abuser when he or she is not in the presence of a counselor or a nurse?
And question 3, it was mentioned with the substance misuse patient that CBT helps to address coexisting issues. Can you further explain?